All right, welcome panelists. I'll go ahead if you want to come in, turn your video on and join us. Welcome to all of you. Thank you so much for being here. I am excited to, we have a room full of students here. It's a little logistically hard, we've determined, to actually show you the students that are in the room, but know that they can see you well up on the screen and they can certainly hear you, and will relay any questions that they might have. So I am going to turn things over to Professor Michael Livingston, who is going to moderate our psychology panel today. Go ahead, Michael.
Thank you, Adia. I really want to extend a very sincere and profound thank you to the alums who have agreed to be here today. All of you have received questions about things to talk about. I would like to suggest that each of you speak for 10 minutes. And Sally, we're going to start with you about the questions or about anything else you'd like to talk about, how you got to where you are now, and what advice you would have for our students. And then we will have about 15 minutes for the students to ask questions, which I can moderate for you. So, Sally, do you want to unmute yourself and start your 10 minutes?
Sure. How did I get to be first? So I am Sally Abel. I am a 1994 graduate of the College of St. Benedict with my major in psychology. From there, and that was kind of a curvy journey getting to psychology. I started out with nursing and then landed on psychology in the end. So just I don't know, something about that. So after college, my first job was with McLeod Treatment Programs, and I was hired as a night counselor at their girls group home. So that was a pretty fancy job. You worked overnights and just monitored while they were sleeping and did things like laundry and stuff like that. From there, I was promoted to primary counselor. So that's where I had like a caseload of girls that were residents at the group home and were in charge of kind of like their goal setting and documentation and running staffings and things like that. And I really liked that job, actually. It's probably one of my favorites. It doesn't pay super well, but was good experience. You got to meet a lot of professionals in the field and just have gain kind of a broader knowledge. From that, I was promoted to treatment coordinators, which was kind of a middle management position, kind of overseeing other primary counselors and overall treatment goals of kids at the girls at the group home. And then from there, you know, I had gotten married in the meantime, started having kids. So at the group home, you have rotating shifts, or sometimes you're working nights or days, or kind of depending, and filling in as needed when people needed off. So that wasn't working super well with 2 little boys and a husband. So looked into other things and landed on a child protection specialist with McLeod County. So I started with the county in 2000. And I at first was hired. They were just starting the alternative response family assessment program. It was kind of a more family friendly version of child protection, where it wasn't just about determining if maltreatment occurred or not, but kind of what were the needs of the family, and kind of working on strengths and providing crisis, like if they had emergency crisis needs, kind of filling those in and seeing if you more rapport building and service planning other than just fault finding. So I started there, and from there I kind of ended up doing a little bit of everything. So I did the family assessments, I did investigations, which is where you go in and do work with law enforcement and do more of the investigation piece of it, and doing, you know, did maltreatment occur at our services that needed. I did, and then probably mostly did like case management. So that's after the assessments and investigations, and families need services. I did that, like arranging services, kids were in placement, managing their placement, things like that. So I did that and I'm giving you a very broad overview, and I hope you guys have lots of questions and clarifying things to ask me. That'll be easier than me just rambling. I'm not super good at that. I did that for 10 years, and then I am now, and from there then got supervisor. So I'm a supervisor of the child protection unit. And at first I supervised the whole unit. So that was, I had 16 people underneath me. And I had everything from daycare licensing, foster care licensing, adoptions, minor parents, investigations, assessments, intake, case management, minor parents, all the programs. And, you know, at first it was doable, but as is the way of government work, things get more complicated and demands are greater. And it really became apparent that we probably needed to split the unit. And so now I have a co-supervisor, which is relatively new, actually. It just happened in May. So I have been in supervision for 11 years. So I've had a pretty long history working in county social work. I'm assuming I'm supposed to continue to go through the questions. So what was it? Something about like how my, like what was helpful in my major or something. So I think like having a decent knowledge of psychological disorders and how those affect people and how it presents in people has been, was very helpful in all my career, like across the goals, across the whole, you know, from the beginning to where I am now. So that has, you know, psychology as a major, that is, was most helpful. Classes that were helpful, I think, were child development, group dynamics, abnormal psychology, just kind of all of it, just kind of having an idea of how people interact, behave, what just, you know, how mental health presents itself in others has been good. What's next was the liberal arts. So I think having like the big picture thinking and knowing that everything and most things aren't black and white is vital. In child protection, you work in a lot of gray. And so being able to see all sides and look big picture and know that not everybody thinks the same, believes the same, and that's okay. But that hopefully you can come to an understanding and a compromise so that everybody can coexist and get along. And like in my work towards common goals of safety for kids. That has probably been most beneficial as far as liberal arts, my liberal arts background is concerned. So what do I like? What is challenging about my job? So basically the challenge and I'm a little bit of a stress junkie. So I really enjoy like the challenge and pace. It's something new every single day in child protection. You never know what's going to happen when you walk in the door. So I kind of like that. I like the making decisions on the fly. Just all of that I think is fun. Sometimes the content is very difficult, but I think it's important that we have people that are able to work within that and help people that are being victimized or unsafe. I think that's very valuable. And in my current role, I like mentoring and teaching my new workers, you know, how to work in this field and watching them grow and in their career. I think that's probably anyways, that I'm enjoying right now. I've done a lot of work in this field and things I think, you know, mostly appreciate your time at school. In college at St. Ben, St. John's, like take in as much as you can, like those opportunities likely are not going to exist when you get out of college. So that would be my advice. And thinking back, I wish I had done more of that. So that would, you know, definitely think about that. And also just a little plug for the county, getting a job with the county is a decent gig. You don't need your master's right away. Like you can make a livable career out of county work. And I am representing, I have always worked in child protection, but there are lots of other areas in the county that you can work in. Children's mental health, adult mental health, chemical dependency, long-term care, developmental disabilities. Those would all be available to you as options. And also of note, two of my other supervisors are also St. Ben's grads. The Leah, who supervises mental health, children and adult, and CD. She is a graduate of St. Ben's. She's a little younger than me. And then Donna does some of the long-term care stuff. She's older than me. She is also a St. Ben's grad. So I think I fulfilled my 10 minutes.
Thank you very much, Sally. We're going to try to break it up a little bit If there is one quick question from the students here, we'll ask it, and then we'll go on to Charlie next. We're going in alphabetical order. Do any of you have any quick questions for Sally? Okay, hearing none. Charlie, take it away.
Sure. Can I get a thumbs up if my audio is okay? My audio okay from the panelists? I can only see the panelists. Okay. Thank
Your
you.
audio is good.
Okay, good. Sometimes it's not, so I just wanted to check. My name's Charlie Black. I am a 2002 graduate of St. John's and currently a middle school counselor at the Hastings Middle School in a southeast suburb of the Twin Cities. And this is my 18th year. I went into St. John's with an accounting focus, and after a few classes, just realized it wasn't a right fit for me. So took intro to psychology and just loved it. And so I just kept taking psychology classes and just went with it. So didn't really have a plan. You know, my senior year, did my internship at St. Cloud Children's Home and enjoyed that, working with youth. I'd worked with youth my whole life. My mom had an in-home daycare when I was a kid, so did that. And then as an athlete coming through high school, worked at a lot of youth sports camps, and then worked at YMCA camps in the summer. And so worked with kids. I knew I wanted to work with kids. And my senior year, I was actually getting my wisdom teeth out. So I was sitting in the operating chair and talking to the nurse, and the nurse was saying, "Oh, you know, what are you doing after college?" And I said, "I don't know. I'm going to have a psychology degree. I know I want to work with kids." As I knew I wanted to coach as a former athlete, and she said, "Well, my son just went back to grad school to get his master's in teaching. He just went back for 1 year and got his master's of education and became a teacher. I can't remember what his undergrad was, but it wasn't teaching." And I said, "Okay, well, that's, you know, something I could possibly, you know, that would fit into my interest areas." So I looked into it, and obviously school counseling with the psychology degree seemed like a really good fit. And one of my former coaches, who was actually a St. John's grad as well, he was getting near retirement. He was a middle school counselor here at Hastings. I'm from Hastings. I'm a townie, and talked to him and learned a little bit about what it means to be a school counselor, and sounded good. So I applied. I went to UW River Falls for their school counseling program, and I just did it. At that time, it was still a lot of like teachers going into school counseling. So like teachers that would take night classes to go to get their master's in education counseling. And so it was all night classes. So just got a part-time job, lived in St. Paul, and just cranked it out. I went through the program as fast as I could. And then, yeah, coming out of it, doing my experience, you know, my internships and practicum experience. I liked elementary school. Being in a daycare setting, I was comfortable with little kids and wiping noses and tying shoes, and I could work with young kids, and felt like high school, you know, they're somewhat, you know, relatable and have a little bit of a head on their shoulders. And I didn't think I could do middle school, and just a unique age developmentally, but job opportunity came up and applied because needed a job, and I got offered the job, and I love it. I love working with middle school. I never in a million years thought I would. It's a unique, if you've interacted with middle school kids, and some challenges, and it's so rewarding being able to be an adult in the life of a kid who doesn't want adults in their life, right? Sometimes, not always, but adults don't know anything, their parents don't know anything, and if I can be just kind of an adult influence in their life, it's really a great opportunity. And I will say, you know, I'm at a midlife crisis, so I'm like, 41 years old and considering, switching professions. So I'm looking into different stuff, because I just don't know. I don't know if I can't finish my career in education. I gotta do something else. But the one thing people ask me when I think, what I really like about my job also is that in public education, it gives you an opportunity to work with all kids. I say that, like, there's some kids who need therapy, but because of multiple reasons, they just can't access therapy. So, so as a therapist, you're not going to necessarily get to work with all students, and so that's just one thing about public education that's really been great. I can work with all students, as long as they come to school, I can meet with them. So yeah, it's been good. I coached varsity sports for the first 8 years, and then coached middle school sports, and now I have young kids of my own, so I'm coaching them. So I've been involved in coaching, which has been a nice combination, working in the schools and coaching. Yeah, so that's my professional journey. What I was involved in when I was at St. John's and St. Ben's, I played football, and so that was when John Gallardi was the coach there. He's the legendary coach before Gary, and so I had a great experience. And part of the question was, how did that influence my career, my profession? And you hear sports, teamwork, communication, all, the hard work, the things you learn from sports. But one thing, as I was reflecting, I was actually talking to a student recently, and it was part of a message at church, just the concept of legacy and what St. John's has for tradition, and what John Gallardi left for a legacy with the football program, really meant a lot for me. Just the importance of tradition, success, building success, and there was just a lot about the football program that really stuck with me. One thing that John always was really good at was learning people's names. And I've really worked on that. So like when I'm in the halls at the middle school, I try really hard to learn kids' names, and just how meaningful that is to a person when you know their name. And so that was just one, another thing I got out of my football experience. I was in the peer resource program. I don't know if that still exists. But so the way I got involved in that was sophomore year. People were talking about spring break trips, and I wasn't, didn't want to do the Fort Myers thing or whatever. And so I saw a flyer for a hiking trip to the Appalachian Mountains. So I signed up for that, and we went hiking, and it was put on by the peer resource program. And talking with some of the leaders, they encouraged me to join the group. And so I joined, and what we did back then, part of our program was doing low ropes challenge courses. So I did that, and that was good for me, learning how to facilitate leadership rather than more be like a direct leader. So it just kind of that was a good experience. And then I led a trip to Big Bend, Texas, a hiking trip my senior year. So did that, and just really enjoyed the outdoor component of that. And then the other thing I did when I was at St. John's, I studied abroad in South Africa. So my junior year, spring semester, went to South Africa, and it was an incredible experience. Really, opened my eyes to the way other people live, so that's helped me professionally. It really helped me to have the experience of being a minority. We were at a soccer game, and it was a professional soccer stadium, professional sports team, major stadium, and the group of 12, I think it was like 12 of us that went, we were the only white people in the stadium, and it was a really good experience to be on. I've grown up in Hastings. It's primarily a white community. There's diversity, but that was, just things like that, being able to travel the world and have that perspective. So I don't know how old everybody is, but if you can study abroad, I would suggest it. Hopefully, I don't know what the you know, where everything is with that, but just being able to travel the world without, you know, at a time where you don't have a house payment, you don't have necessarily have a family that's, I don't want to say tying you down, that's not the right way to put it, but I would really recommend studying abroad if you have the opportunity. So that's what I was involved in. With the liberal arts degree, like Sally talked about, just having, you know, perspective, you know, a broad range of topics, and just, you know, I would have never taken art classes at a, you know, if it wasn't for a liberal arts program, and really liked it and realized that I actually had some talent with photography and stuff. So those types of things were, you know, made my experience more enjoyable and broadened my perspective for sure. What do I like most about my job? I think, you know, I talked about being able to work with all types of students. One other thing I like about my job is my days fly by, like just blink of an eye. I show up and it's like Sally said too, you just never know what you're going to get at a middle school. You know, there might be a pretty intense conflict between kids. There, you know, somebody might have just experienced a tragedy, and it's just, you show up, you might have a plan, but plans change and you just kind of take it as it comes, and the day flies by. And so that's a nice, I've never bored. There's always something to do. So that's been, you know, a good part of my job. I really do like being with people through their most challenging times. You know, not necessarily fixing things, or you don't always even have the right words to say, but just being with them and being on the journey with them. So I've worked with, you know, lots of kids and lots of families with really difficult situations, and that's really rewarding. And I do live in the community that I work in. So another part that I like is just seeing kids when they're grown up, and seeing, you know, parents of kids too that I've worked with years later that just come up to me and say hi and thank me for what I've done for them and gotten them through a tough middle school experience. So that's rewarding. There's a lot of rewarding, you know, a lot of rewarding parts of the job. What I like least, paperwork. I'm not a desk guy. You know, and so that's, you know, I obviously I work on it and I try to get better. But my skill set is just kind of taking things as they come to, and taking care of whatever comes up. So that, you know, the paperwork, that's, you know, the email, getting bogged down with all that stuff is not the fun part of the job. You know, the benefits too with being an educator are really good benefits. Insurance, retirement, just good benefits. So that's something to consider as you're, you know, thinking about career path. Advice I would have, if you do want to go into something with education or working with kids, I would recommend like doing like YMCA camps, finding jobs that you're actually working with kids, and even having like a YMCA camp counselor. I just use that example because you're working with the kids all day, you're building that relationship, but you also have some parent engagement. So that's a nice experience. As we're hiring staff, we do look for experiences like that. So just you know, finding those jobs, getting those experiences, and really thinking too as you're exploring careers. I know this is something I would have never thought of when I was in college, but just as I've gotten older, really taking time to try to figure out like, what's your purpose? Like, what were you put on earth to do? And sometimes we find that without really putting a lot of time and effort into it. You know, I feel like I have followed my purpose and found that even though I wasn't trying. But as I've gotten older, reflecting more on that and just using that as you're choosing careers, you know, find out your strengths too, and make those decisions based on your strengths. These are all like inspirational, like follow your heart, trust the process, all those things, but do trust the process, and good things will happen. You'll end up where you need to be, and just enjoy college. I think Sally mentioned that. Holy cow, enjoy college. It's the best years of your life, typically, not always, but enjoy the ride, and yeah, that's all I got.
Thank you, Charlie. Aiden, we're going to go to you next. We're going alphabetically, so take it away, and we'll still have we're still good on time, so we'll still have time for some questions at the end as well. Go ahead, Aiden.
Hello, my name is Aiden. I'm a 2018 grad from St. John's. I minored in psychology and majored in psychology, minored in theology. My path to my career currently has been a bit winding, because during my time at St. John's, I was very undecided in what I wanted to do and what I wanted to major in. And so it took me up until the last point in sophomore year to kind of declare a major. And obviously I declared psychology, and so far I've really enjoyed that choice. And then after got a senior year, didn't really have a plan for after graduation. And so I took a gap year and did the BVC, or Benedictine Volunteer Corps, that is put through St. John's Abbey at St. John's here. And I went to Tanzania for a year of service, which unfortunately ended up being only like 7 months, just due to some visa problems. Then I came back to St. John's and finished my service year there with monks at St. John's. And then I applied to a wide range of jobs. And the first job that kind of came back to me was the Emily program in St. Paul. And it's a program, if you're not familiar, it's a program that kind of helps treat individuals who are struggling with eating disorders and other related mental health issues. And so I've been there for about 2.5 years. And I recently stepped down from that and started working as a psychiatric associate at the University of Minnesota Medical Center. So these two places are a little bit more acute settings than schools or elsewhere. Primarily at the Emily program, I worked with adolescents in a residential setting as like a 24-hour we helped support meals and snacks and kind of manage milieu there, de-escalate clients if needed, and make sure they are all safe and not using symptoms. And at the U of M now, I, as a psych associate, I do relatively the same things, although with a wide range of age groups. So at the U of M, I'm a float pool psych associate, and so I get to work on all the other psych units. Mostly lately, I've been on the adult units, and so I've been running into a lot of differing and varied diagnoses and age groups, which has been a good experience. And now, during my time at the Emily program, I decided to go to grad school, and now I'm just starting my second year in St. Mary's University's program for marriage and family therapy. So next year I'll be starting my practicum experience. And so hopefully in 2023 I'll be graduating and on track for licensure there. what was I involved in at St. John's? I was involved in the SJU swim and dive team for all 4 years. I also swam in high school. I was part of Fres Life. I was an RA sophomore year. I was part of Knights of Columbus campus ministry and fine arts programming as well. I worked as a house manager for fine arts, and I also worked in the St. John's Dining Hall for a very, very short period of time. Those experiences have definitely helped me, and I've used those experiences in my work for sure. Being an athlete has definitely encouraged me to continue it, being an athlete and a coach as well. And definitely, I use it as a self-care thing. After stressful work shifts, I can go and swim it off, so to speak. And then, being a house manager for fine arts programming has definitely helped me practice like overseeing new employees and kind of overseeing the ushers there. But also in the Emily program, I was part of the training team. So I trained in new employees when they came in and train them to kind of look over and support meals and snacks for the Emily program as well. Coming from a liberal arts background has definitely helped me a lot in my career. And I definitely agree with the other two panelists have said about this as well. Just giving you a good base of a lot of subjects has personally helped me kind of build rapport with my clients. An example being, I never would have thought I would be in conversation with a client at the Emily program about Chopin and his nocturne suites for piano and classical music. And I learned about all, Vivaldi and Beethoven in my music classes at St. John's, but I majored in psychology, and we were talking about classical music and trying to, build rapport with the clients at the Emily program. So that was a very cool experience. And so just kind of having a base knowledge about and taking advantage of all the different classes that you can take there is going to be very, very helpful. Just to kind of build your awareness and knowledge base that you can relate to others. What do I like about my current work? It's since I work with a lot of acute clients and kind of see people at their worst, so for lack of a better word, I really like and look forward to seeing the small successes and the day-to-day celebrations that we can kind of celebrate with them. Whether it's seeing a client get through a difficult meal using a skill that I recommended, or getting a client to de-escalate for the first time, or or just kind of knowing that just sitting with them and having a person to listen to is super helpful for them, and they will appreciate it. Just kind of focusing on those small positives will really be beneficial, because if you kind of get too focused on what they're dealing with in the moment or their diagnoses, then you might get too bogged down with the fact that and thinking about all the negative things that could be happening or could happen, knowing that they will most likely be dealing with these diagnoses for the remainder of their life, which can be almost promote burnout in you. And so just kind of focusing on those day-to-day small celebrations and successes is very important. Most challenging, I kind of mentioned it already, just seeing people struggling a lot in many different ways, and knowing that they're gonna be dealing with this for a while, and there's some things that I can't really unsee, just based on the fact that I've seen a lot of adolescents and adults kind of go through high urges of just unhelpful things, and seeing them kind of struggle through a lot. Some advice, I'd say stay open-minded, and be willing to try new things, and try new things often, as much as you can, but also challenge yourselves frequently too, because I don't think you can kind of grow and learn things without doing that, and know that you may not get the job that you want right after college. I certainly didn't. Right, I didn't really expect to go to Tanzania for 7 months. That was definitely not on my postgraduate plans. I certainly surprised myself by signing up for that. But know that whatever experience happens after graduation, it's an experience that you might need and might learn from. So just keep an open mind, and just kind of go with the flow, but challenge yourself.
Thank you very much, Aiden. ¿Cómo se pronuncia su nombre de pila?
Charissa.
Charissa. Gracias, muy amable. Our next speaker is Charissa Romero, and after she has a chance to speak, we will open it up for questions. Go ahead.
Okay. So my name is Charissa Romero. I currently work as a bilingual children's mental health case manager. So I am one of the Spanish-speaking case managers at Headway Emotional Health Services within Hennepin County. So after St. Ben's, my first job for 2 to 3 years was actually working at a children's residential treatment center. They were formerly located in Minneapolis. So I worked with a lot of adolescents who were had a lot of EBD, so emotional behavioral disorders, so depression, PTSD. My treatment facility specifically focused on, we got a lot of teenagers with a history of self-harm, suicidal ideation. I worked as a residential counselor, so I worked a lot in like de-escalation, crisis work, and just kind of keeping them safe, like literally keeping them safe at times. Did that for 2 to 3 years, found myself really enjoying that work, crisis work, but really wanted to give something else a try. As you guys know, psychology in itself is a big field. There's a variety of topics that you can study or continue doing after college. So I went, and now I'm currently as a bilingual Spanish-speaking case manager, where it's more towards versus individual one-on-one mental health. Now it's more towards like the social service, connecting a lot of my family, my kids to services, and helping them kind of navigate a lot of the mental health and medical systems, and kind of assisting them to overcome a lot of barriers that also come within the system. So that, I think, was like question one. So the second one was, so what did I do here at St. Ben's? So again, like psychology is sort of what I knew what I wanted to do. It's a big field. There's a lot you can within that field. So I wasn't sure at first, freshman, sophomore year. I know psychology was it, but didn't know where exactly I wanted to go in that direction. So what I started to do was actually attend a lot of the kind of the research or study groups that professors offer, just to get a feel for if I really wanted to focus on maybe gender, multicultural psychology, and so forth. So I did one group where she's not there anymore, but Professor Platt offered sort of a gender group where we helped her code some of her research data that she had conducted a few years back. I did another project with Jan Holtz, who taught multicultural, I think, clinical and counseling and neuropsych at St. Ben's. So she is really tied to the community in St. Cloud and does a lot of work with adults who have traumatic brain injuries. So my time with her, along with a couple of other Benny and Johnny's, where we focused on just kind of developing a curriculum or something to present to the Brain Injury Alliance program. So they would hopefully open up like a group home for adults who do have TBI and need that sort of additional support service. And before I continue on, I was the class of graduate of 2014. So those two were kind of the things were kind of my bigger things. And then I also worked as the PR, public relations for the Cultural Affair Boards, which I found throughout my couple of years at St. Ben's to really enjoy kind of focusing more on the multicultural aspect in psychology, and being able to bring that not only at school, but more in my work life as well, and becoming an advocate in that area. So those were kind of, I think, for psychology. And then the third thing I would say, so for the third question, liberal arts degree, so kind of just following off what everybody said, where, you know, it's a variety of subjects, liberal arts, you get a lot of prereqs you have to finish off. I think along with being exposed to a variety of subjects, you also get to meet very different people. I think regardless of what field you end up choosing to work with, you're going to have somebody who doesn't align with the same beliefs or have a same value system as yourself. And you will have to learn how to work with that. You may have to learn how to work with that person. In my sort of specifically for my field that I work in, I may or may not. I will always have a client that will have some sort of belief system or something that's different, and I need to learn how to provide my service in that system in order for them to kind of progress in it. And I think part of that is going through a liberal arts is you learn about yourself when you start exposing yourself to different opportunities and meeting different people. Because as you get older, if wherever you choose as a provider or a professional, part of my job is like I serve my clients, but I also have to be very honest with myself if it gets to a situation where maybe I can't get over a certain sort of belief or value, there's something that's just not there that I can't go over, then I need to be honest that I can't serve a client or a family. So I think that's part of, I think what's helpful with the liberal arts is you get exposed with, if you choose, you know, to put yourself in these opportunities, is being exposed to a variety of people with very different opinions. But again, I think no matter where you choose to go in your education, it's what you choose to make out of it. It's the more you put yourself in these situations, opportunities, then you'll get more out of it. So the fourth, I think, was, so what I find challenging or what I enjoy from my job. So my current job, what I like most is seeing my kiddos progress in their treatment. And I've learned working in this sort of field like 2 to 3 years in residential and in extensive like crisis work, and then now working with families, more of a families and system and with kids is, I think a lot of people, what they don't tell you is when you go into the area thinking, yeah, I'm going to go and help families, I'm going to go help kids. And the reality is not every kind of situation or case or kid that you're with is going to be that straightforward. It's simple. A lot of times you don't get to see the end journey. You're just kind of part of the journey. You may not get to see the end result. Like in both jobs, I'm just kind of there to stabilize so they can hopefully get to the point where they're out doing these things on their own, being self-sufficient, getting access to the service they need, and then learning how to maintain those services. So what I like seeing is just progress. So part of that is, as I learned quickly, is it's not this sort of idea of like, oh, I'm gonna help people, or it's gonna be things that are gonna be like help them with improve. And what I've learned quickly is how to kind of help with burnout and stuff is how you choose to define success and what you do with the work that you do. And knowing that, I don't get to see the end result with a lot of my kiddos or families, but seeing them like go, maybe seeing a kid who probably never attended school for like months or weeks because they had severe social anxiety, they had a horrible experience with school, and then being able to connect the parents to academic resources, getting them in special education services, seeing, just getting the kids the right resources, and then seeing them go from maybe not going to school for like 3 weeks straight to maybe going once a week. That's progress, especially if they have a significant history. That's progress right there. Of course, that's not my end goal. Neither it is for the parents, but I think being able to find your definition of success within the work that you do will be very helpful. So that's something I also enjoyed, and just seeing my family, especially my parents, since I am a Spanish speaking case manager, a majority of the families that I work with, parents are Spanish speakers. And as quickly and I grew up here in Minneapolis. I'm a native to Minneapolis. I serve all the cities in Hennepin County. So I grew up in the system. So I know the system isn't built for everyone. And I still see that till this day with a lot of my Spanish speaking families. I have kids who literally don't have health insurance because they aren't documented. And there's probably it's hard to get services for kids. It's hard to get services for adults. So there's a lot of barriers. The system isn't built for multicultural families. It really isn't. So what I really enjoy seeing is once kind of teaching the families, parents and kids kind of to navigate the systems and help overcome those barriers, and seeing them become self-sufficient is probably the best thing. But it also becomes the most challenging because you see really fast how the system really isn't built for a lot of multicultural families. It's improved over the years in some ways, but it's definitely a challenge. And that's something that's probably the most challenging, is seeing that, or when I have parents who aren't in the place to engage and follow through on services, whether it is to make appointments for their kids, completing intake, signing paperwork that needs to get signed. That's also a challenge, because at the end of the day, maybe if the kid wants to do the service, but maybe the parent doesn't want to do family therapy, which is also really rare to hear, but at the end of the day, they're the guardians, they signed the paperwork. So that's also a challenge, is having parents who may just have their own mental health going on and just not in a place to do the work that is needed to be done. So my advice is, I think in addition to what everyone has said, as looking back at my time as being a woman of color, being a member of the BIPOC community, is, for those who are either maybe new to this sort of environment where you are predominantly in a white environment, is being able to find or create your own safe space there at St. Ben's. Whether that is like at your dorm or your apartment with your roommates, it's like, whatever the music from your culture is, whatever was home to you, bringing that over to St. Ben's or St. John's, finding friends that can relate and kind of go through the struggles of what it's like to be a BIPOC in a very predominantly white environment. Being able to build some of those skills, because that also happens even within the field now. Like there's like a very extremely underrepresented like BIPOC. We really need a lot more people of color or bilingual, multilingual providers, even in this field, and males as well. There's a lot more women in the field than males. So my advice would be more towards geared for students of color, is just being able to find and create your own safe space. figuring out what that looks like for you and kind of mastering some of those skills, and then kind of finding hopefully a staff member, whether it's professor, somebody else out in the community, that you can go to as kind of a comfort and for resources and help as needed. That was a really big help for me in my time in St. Ben's. I was part of the Intercultural Lead program, was being able to go and be surrounded by sort of like mentors that got it. They got it that I was this first generation student. I didn't have parents who attended college, let alone a private college. My mom just kind of went through the second grade back in Ecuador. So it was nice to be able to have a safe space and go to another adult and just kind of talk to them about it. Because 18 legally, you're an adult, but you're still pretty young and learning to mature in so many ways. So I would say that for advice, and then just for folks who BIPOC or not, is just being able to put yourself in opportunities that are outside of your comfort zone. And I think being just able to take care of yourself, learning to take care of yourself, whether that's physically, emotionally, spiritually, whatever, a combination of all of it, being able to take care of yourself. Because as I learned, and I think some of the others have touched up on this, is kind of working in the field that you work in. It can be, you learn a lot about yourself, but in order to prevent burnout, or what's also called as secondary trauma, you got to really learn how to hold a lot of boundaries, practice a lot of self-care, and being able to separate kind of that, your work life from your personal life. But yeah, I think that's about it.
Thank you very much. And we still have about 4 minutes, or actually 3 minutes, they're telling me. If any of the students have any questions for any of the panelists or for all of the panelists, we have 2.5 minutes now. I want to thank all of the panelists again. We are very, very grateful that you are willing to come back and spend time with the Johnnies and Bennies and offer your advice perspective. I hope you realize, I hope the panelists realize that you provided the current students with some really valuable pieces of advice and experiences. And we're very grateful that you were willing to share those with us. Have a wonderful day, all of you. And thanks all the students for coming.
Thank you.